Today is Wednesday, May 20th, 2020. Coming up on Roland Martin Unfiltered, lots of news about the COVID-19 pandemic. Donald Trump is defending his use of hydroxychloroquine, even though it's dangerous. He also released a sad report on the virus and health disparities that the House and the Senate are calling woefully inadequate. Doctors and scientists are concerned about a mysterious new pediatric illness that appears linked to COVID-19. We'll be talking to Dr. Ebony Jade Hilton about that. Also, we'll learn about false negatives in testing. A federal judge says all Texas voters can apply to vote by mail during the pandemic. And Donald Trump is attacking states that are sending out applications for folks to vote by mail. The Republicans do not want you to be able to vote en masse. The Center for American Progress recommends that all states should be focused on that issue of voting in by mail. Plus, an 11-year-old black girl is attacked by a white woman who accused her of stealing mail. We'll talk to the little girl's attorney. And another crazy-ass white woman in Virginia called her local Lowe's to say she only wanted white delivery drivers. Plus, Teddy Riley joins us. We'll talk a little technology. Y'all need to stop with them memes about Teddy Riley. Plus, comedian Chris Spencer is in the house for Why Not Wednesday. It's time to bring the funk on Roland Martin Unfiltered. Let's go.
He's got it. Whatever the biz, he's on it. Whatever it is, he's got the scoop, the fact, the find. And when it breaks, he's right on time and it's rolling. Best believe he's knowing. Putting it down from sports to news to politics. With entertainment just for kicks, he's rolling. It's on go, y'all. It's Roland Martin, rolling with Roland now. He's funk, he's fresh, he's real, the best, you know he's Roland Martin now.
Folks, as of today, there are 1,579,387 confirmed cases of coronavirus in the United States. 94,167 people have died. 364,000 people are recovering. But it seems as if the Trump administration doesn't give a damn about that. They're focused on picking silly fights with people on a variety of issues. Now you got Trump doubling down on defending himself against criticism from medical experts that his announced use of a malaria drug against the coronavirus could spark widespread misuse and it has potentially fatal side effects. Here's the whiner-in-chief.
The FDA has said hydroxychloroquine should not be used outside of a hospital setting or...
No, that's not what I was told. No, there was a false study done where they gave it to very sick people, extremely sick people, people that were ready to die. It was given by obviously not friends of the administration. And the study came out, the people were ready to die. Everybody was old, had bad problems with hearts, diabetes, and everything else you can imagine. So they gave it. So immediately when it came out, they gave a lot of false information. Just so you understand, great studies came out of Italy on hydroxy. You know what I'm talking about, right? Right? Great studies came out, and the combination of the three. But we had some great studies come out. Italy, France, Spain, ourselves, many, many doctors, but I think it's worth it as a line of defense, and I'll stay on it for a little while longer. I'm just very curious myself, but it seems to be very safe. But that study was a phony study put out by the VA.
Cable. And here we go. Trump with his usual nonsense. There's all kind of other stuff that's going on when it comes to the issue of the coronavirus. They're spreading crazy information. They're spreading misinformation as well, folks. It makes no sense what is going on. You also have doctors and scientists in the United States and Europe concerned about a mysterious new pediatric illness that appears linked to COVID-19. Instead of attacking the lungs like the adult does, like the disease does in adults, this syndrome, while seemingly very rare, can trigger serious and even deadly cardiac complications in children. Plus, we have false negatives involving coronavirus as well. The Abbott test they've been touting, FDA is warning about that as well. Lots of things to talk about. Let's bring up, of course, sister, you know her so well. We've had her on the show many times. She's been giving great information on this, and that's Dr. Ebony Jade Hilton. She's associate professor, anesthesiology and critical care medicine, University of Virginia, and medical director at Good Stock. Dr. Hilton, glad to have you back on the show.
Thank you for having me back. I wish there was nothing to talk about, but here we are.
All right, so we've got craziness from the whiner-in-chief touting this drug, and what's interesting is his own doctor put this statement out, but nowhere in there did the doctor actually say he prescribed the drug. And you know, they're dancing around this, and so what do you just make of the silliness coming from Donald Trump about this drug?
I don't believe him at all, for one. It is one of those things that I think he says things on the spur, and it's unfortunate that we cannot believe and trust the words of our president that's in charge of keeping us all safe and keeping our nation intact. But I think he truly made that up on the spot, which is why he couldn't say the word hydroxychloroquine and tried to play it off, which is why he also couldn't say the word doctors. Also tried to play that off. I think we have a problem. But that being said, to either lie about taking it or to pressure a doctor into prescribing it for you when there's known risk and side effects of this drug, when there's no clear indication for you to take that drug, that is insanity in either direction.
And again, you have this constant defense of it, even though the test results have shown it is not doing anything for these people who are suffering from coronavirus. It's like this idiot can't get it through his head that he's wrong.
Right. And the study actually came out of the University of Virginia, where I work, looking at VA patients. And what we saw is that it actually had worse outcomes, that those patients who were on hydroxychloroquine alone had higher mortality rates. That means they died. And the thing is, he brought up the fact that these patients were already really sick, that they were really old, they had many comorbidities. But that's the type of patients that we actually have to put you on medicines when you have COVID-19, because you are dying and we're trying to figure out a medicine that could help you not to die. So the fact that this medicine caused more people to die while on it is a bad indication for its utility in medicine. And so even in his own words, he basically explained why we are not using hydroxychloroquine at the University of Virginia.
So again, the FDA has warned that the only people who should be prescribing this drug is if people are in hospitals. So people who are at home should not be taking this drug just for the hell of it.
Yeah. I mean, this drug is excellent for what it's useful for. Those with lupus, those with other types of conditions that have been prescribed this medication and monitored, their lab work monitored, their EKGs monitored, fantastic. If you have malaria, fantastic. But if you're just taking this as a preventative, as he's suggesting that he is doing, that's not what you do. If anything in medicine, as medical providers, we try to get you off of medicines as quickly as possible, because we know that every medicine has a potential for a side effect. Yes. And this medicine in particular has a decent amount of cardiac arrhythmias that are associated with it. And so we try to limit its use as much as possible, but there are certain conditions where people need this medicine, and we need to use that medicine for those individuals and not for someone who's making up things at the spur of the moment on a press conference.
So for all the folks who are sitting here watching, who are paying attention, I keep saying this. If there's any advice that's coming out of the mouth of Donald Trump, completely ignore it. Even Neil Cavuto on Fox Business was saying the exact same thing.
Ignore it and or do the direct opposite is what I found to be most accurate, because, for instance, he's not wearing a mask, of which, yes, we know that the mask does not 100% prevent any transmission, but he is around how many people now that are testing positive for COVID-19? And for him to continue to be reckless in his practice is absolutely, I think, the pure definition of insanity. At a certain point, you have to realize that we are all mortal, and that he's putting himself and therefore our nation at risk.
All right, I want to bring in my panel here. A. Scott Bolden, former chair, National Bar Association Political Action Committee, Lauren Victoria Burke, NNPA, Dr. Jason Nichols, Department of African American Studies, University of Maryland. Jason, I'm going to start with you, and folks keep Ebony there, Dr. Hilton there. Jason, what I see what's going on here is, and again, I see complete dereliction of duty coming from this White House. You have Trump in these news conferences making people take off their masks to ask questions. You have cabinet meetings where they're not sitting spacing away from one another. You've got Mike Pence who says he's not on this drug, but he's been self-quarantining because one of his staffers actually tested positive coronavirus. I would dare say everything that should be done to take precautions against this, follow nothing this administration is doing because they're not practicing what the doctors are actually preaching, Jason.
I mean, I think you've pretty much said it all. The fact that, he's taking this drug as some sort of prophylactic against, the virus, and there's no evidence of it. We haven't seen it in any kind of clinical trials. I was just reading a new study out of China that says that none of that works. We saw Stephen Miller got it. His wife got it. It's running through the White House. He's not wearing masks. He's being reckless. He's setting a terrible example. And that's not what leadership is. What leadership is first setting the example yourself in order to make this country safer, in this case, flatten the curve. And he's really, setting a terrible example for, everyday Americans. And now we have children, dying. We had a child in Baltimore who just passed away from, COVID-related illness. So this is a really terrible situation when you have someone who is not responsible and derelict in their duty.
Lauren, here's what I think is happening. And Dr. Hilton, I would love for you to weigh in on this as well. 94,000 people are dead, okay? They've said, it's going to happen by June 1st. At the rate we're going, at the end, look, I said this last week, it might happen by Friday. They refuse to acknowledge what's going on. Now we're hearing about a woman fired in Florida. They're trying to fudge numbers. We saw what happened in Georgia. I mean, you have, and we already know what the administration has tried to do by questioning the CDC numbers. They want to be able to suppress these numbers because it's bad news for them, Lauren.
Exactly. He's trying to turn the page, and he can't turn the page. I mean, this is a president, as we know, who thinks everything is about PR. He doesn't want to have this branded to him, which it's completely branded to him. It's completely branded to him because he didn't read his intelligence reports in December and January and February. There's no getting around it. We're going to hit 100,000 in probably less than a week. He is trying to turn this into another conversation and what the economy looks like after this is over, but it's not over because the stats are still coming in. He can't deny that. And, there's nothing like 100,000 people dying to stop all the PR and all the nonsense. And he can't spin his way out of it. He won't spin his way out of it. There's nothing else really to say. The fact that he won't wear a mask is really related to his own vanity and his own PR, obsession. He doesn't want to be photographed in a mask. He doesn't want to be seen in a mask. He knows that a photo of him in a mask is the actual epitome of this thing reaching right into the White House, which it already has done. And that's why he's not wearing one. So, he's childlike. We know he's childlike. I think Joe Biden is going to get elected as a result of this and everything else that's about to happen with regard to the economy, which is all going to happen on his watch. And he can't blame anybody else, can't blame Barack Obama or anybody else. And basically he's trapped and he knows it.
Ebony, surely as a doctor, it has to offend you when you hear this woman in Florida say she was fired because she refused to fudge the numbers, when we know the wrong numbers were given out by the state of Georgia. And then now you have the federal folks, Trump's people, challenging the CDC, saying that their estimates are too high. I would think look, as a medical professional, you want to trust the medical people with numbers, not the political people.
I mean, it's incredibly insulting, considering the fact that many people are literally risking their lives to show up daily to the hospital. And the way that we are best protected is that we have fewer people coming in infected. And so if everyone can serve their part, the better that we can actually, I don't know, live too. But the fact that he's trying to basically lie in plain sight, I can blame him, and I do blame him. But honestly, my question is, where are the checks and balances in politics? And that's who I question is, why is this allowed to still happen? And it's been happening now for 3 months. And I'm just wondering, where are the senators? Where's the 25th Amendment? When are we going to say this is done? Because he's being reckless.
Well, here's the deal. That's not going to happen. They're not going to do that, Scott. The Republican Party has circled the wagons from day one. They do not want to tick him off or his base. They don't want to get blasted in tweets. But here's the interesting. I haven't seen Dr. Fauci since he testified before Congress last week. And I think what you see here is you have Trump and his imps upset that Fauci was getting the level of attention. And so what do? You sideline him. Now, granted, he did go into quarantine because self-quarantine, but guess what? Laptop still works, Zoom still works, Skype still works, even if you're in self-quarantine. And I think what you're seeing here by this administration is they do not want to tell the truth. And I keep telling people, hashtag Trump Lives Matter. I just believe nothing that comes out of his mouth unless it is verified and proof is offered up by somebody else.
Yeah, Roland, and to your other guest, this is really dangerous stuff. This is like something out of the Twilight Zone, the fact that we're talking about the President of the United States ignoring science, calling originally that the disease was a hoax. But he's so caught up in politicizing the coronavirus that now he's a walking manifestation of his denial. I don't think he's taking that drug. I think he's like the carnival barker who just makes up anything and goes from there and just walks within that lie. He won't wear a mask because that is the opposite of what he feels or thinks about this pandemic. He won't exercise social or physical distancing because that is the manifestation of reality, and it's not the manifestation of what he's operating in his world. And so he won't comply with what the country and what the world has learned. And so this is dangerous, though. We know that when he said to take Lysol or bleach or suggested it, that we saw an increase in emergency room visits. He's now taking this drug as an obese human being who probably has heart issues because if you're obese, your heart pumps more blood and is subject to heart disease based on his diet, but he's taking that drug anyway. His bully pulpit is manufacturing his politics, and his followers will follow him in not having a mask and taking this drug that is a dangerous drug, and it is just pure denial. Now he's walking manifestation of it. Question is how many will follow? And there are a lot of GOP and a lot of that 40% who support him no matter what that will follow. So in effect, he's really making the circumstance worse for his followers and Americans beyond just making it worse for himself.
So here's what jumps out. Dr. Hill, I want to ask you this here. California, top educators there have said that schools will not reopen unless everyone has a mask on. We also are hearing, someone would tweeted earlier, and I think I sent you a tweet, that a medical expert at MSNBC said cloth masks are virtually useless when it comes to coronavirus. What are you telling our people about that? Now, I know you have one of those super duper, huge masks. But look, that's for medical professionals. But what about the people who are saying that cloth masks serve no purpose? Because I saw one story that said that if people wearing masks, it decreases your chance of getting coronavirus by 75%. So
Right.
what advice do we trust on masks and what masks to wear and what not to wear?
Right. And quite honestly, to be completely truthful, there's a lot about the coronavirus that we don't know. What we do know is that it's transmitted primarily through the large droplets. So when we're saying to wear the mask, is it because it filters out the virus? Absolutely not. The cloth mask that you made out of the bandana or the t-shirt or even the simple surgical mask does not filter out the virus. And what does that mean? The virus is very, very small, down to 0.2 microns. So it can literally fit through the fabric's interlacing, right? But what that cloth mask does is it prevents that large droplet that if someone, particularly if someone is infected and they cough, those large droplets won't hit you directly in your face and get directly into your airway. But that's why we say, in addition to if the mask alone was sufficient, we wouldn't say wear a mask and 6 feet, right? We're trying to basically create as much space in between you and the coronavirus in itself. But honestly, even with the N95 mask, we're not sure if those actually filter out all of the virus too. The one that you see me wear at work, which I will not show for the audience, but it's a respirator, a P100 mask, and that one tends to be the most effective in filtering out the smallest of particles. But it is very uncomfortable. It's not readily available. You'll see construction workers and painters also wearing this type of mask when they're doing their duties. But the truth of the matter is, do we still say wear your simple mask and wear your cloth mask? Yes, because we don't want, if someone particularly is infected, if they're coughing those large droplets off, we're trying to prevent as much of that as possible from getting directly into your airway.
All right, you lucked up because we can't pull up my iPad on this other switcher here because I was actually going to show one of those photos that you have sent me of that huge mask that you're wearing. Jason, I want to swing back to you. Again, this whole little silly fight that you see with these people acting the fool out here, don't want to wear the mask. Oh, I'm free. But we're free. It's about freedom in this country. You know what? Here's my whole deal. If they want to have some mask party and go somewhere and just infect each other, baby, knock yourselves out. But the people who are bearing the brunt of this are the people who are these essential workers on the front lines. They have no choice. And so the sheer arrogance of these people, and yes, it's coming from Donald Trump when he's so arrogant. I'm not wearing a mask. I'm not doing this. In fact, was he at Ford today or was that tomorrow when he's visiting the Ford plant? Where initially the Ford plant said anybody walking this plant must have a mask on. Then they were like, well, you know, that's up to the White House and folks to determine what they want to do. But like the Mayo Clinic, when they said everybody has to wear a mask and Pence chooses not to wear one, then later he goes, you know what, I should have wore one. These idiots out here are following these nuts off a cliff.
Right, and first of all, we need to understand that this is not really, those protests in Michigan and other places, they're not really about even opening up. They're just big political rallies, like Gretchen Whitmer said. If you're talking about being free, you don't wave Confederate flags. That doesn't make sense. If you're going to talk about freedom, you don't wave Confederate flags. You don't block an ambulance. You're talking about opening up, but you block the streets. You know, that doesn't make any sense. An ambulance couldn't get into the bay for 10 minutes in one case in Detroit. So all of this, or in Lansing, and somewhere in Michigan. So all of this is nonsense. It's a political rally. It's a political move. People say they need to get their hair dyed, and they'd rather see other people die. You know, I think that this is just, like you said, complete arrogance. Comes from Donald Trump. It's all about trying to rally his base. This is why he tweets out, liberate this place or liberate that place. And, you know, he realizes this has serious consequences because the longer this goes on, people are recognizing not only are they talking about the deaths and the sickness, but they're also talking about the fact that he was not prepared, and that caused an even bigger economic fallout from all of this. And this is all falling at his feet. So it's all a distraction technique. It's not really about, opening up. I don't even think. I think it's really just some sort of political rally to get people riled up. It's certainly not about freedom in any kind of way.
Roland.
And that's exactly what it is, Scott. What you're dealing it's defiance, it's white anger, it's stoking them and to piss them off because Donald Trump needs pissed off white people in order
Right.
to win in November.
Well, Roland, what would your discussion be if the great irony came to be that Donald Trump contracted the virus because of his recklessness? I don't wish that on anyone, but as I watch him and process and walk through and have this Superman mentality against this tiny germ, I can't help but believe that the possibility, or he's opening up himself personally to the possibility of getting COVID, and he's in his 70s. What would our discussion be then, and what would the GOP say then? Because this is dangerous for him physiologically as it is politically and physiologically for all of us. I don't get it. It makes no sense.
Well, I do get it, Lauren, and that is, again, white anger is what fueled him in 2016. He needs white anger. So what's the whole deal? Get white folks mad at government in Virginia, in Maryland, in Minnesota. White folks going crazy in Georgia. And look, these are not large numbers, but that's what and then what happens? Conservative media drives white anger. Fox News, talk radio show hosts. That is what has sustained. That's what the Tea Party was about. That's what his election was about. It's white anger. And they're looking at what the numbers and they're looking at who's dying. Even though the majority of people who are dying are white, disproportionately who's impacted black and brown people, they're like, that ain't us. We don't care.
Well,
Wow.
yeah, the Tea Party, of course, was about stopping the black guy from doing stuff. The problem with the white anger strategy is that, in politics, anytime you do anything to accelerate one side, the other side notices and then comes out. So basically what you're doing with his little plan, what he's doing with his little plan of white anger is he's doing a African-American GOTV campaign. And that's really what Donald Trump is, a self-contained African-American GOTV campaign. I think the numbers are going to be different for Joe Biden than they were for Hillary Clinton. I think that everybody is getting on the same page with the fact that our president is one of the most dangerous in American history. I don't think there's any real dispute about that. I don't necessarily think this is going to be a particularly close election, but it's going to come down to some key states, as it always does, key 5 or 6 states. I just don't think we're going to see Joe Biden make the same errors that Hillary did. And Fox News can play around all it wants, but there is nothing that is going to spin out of the fact that there's going to be over 100,000 Americans who died from COVID. They cannot. This is the one thing that they're not going to be able to get out of. And you can see the games. They're bringing up Barack Obama. Before they had the hate Hillary and everything was about Hillary. Now they don't have anything, really. They don't have anything to hate, which is what, unfortunately, this modern iteration of the Republican Party has become about. What do we hate? What is it that we don't like? What is it that we're against? And so now they're trying to bring up Barack Obama again, and I just think it's going to fail miserably and be embarrassing.
Dr. Hilton, let's talk about this Kawasaki disease. What have you and your fellow doctors been hearing about that and how this is impacting children? Earlier you said, look, it's so much about this that we don't know, and it's just this constant game of catch-up. Now, Dr. Fauci and others have talked about how children are being impacted, and then when you have people like Senator Rand Paul and others who are saying, open the schools back up, medical pros are saying, hey, hold up, we don't know yet how this is impacting kids.
It's incredibly reckless to me. I think of 2 different groups of people should be sacred in our nation. That should be kids and the elderly. And we have shown zero respect for either of those groups. And when we're looking at this, so we call it the post-inflammatory syndrome, and it very closely resembles that of Kawasaki disease. But what it is that there's an inflammatory process that happens along the vascular system. And what we're seeing with these kids is they're having issues with the arteries of their heart, the arteries of their kidneys, their GI tract. In fact, in the United States right now, we have 100 cases in 14 different states. And so from the very beginning, when they were touting this, oh, kids are safe, my biggest thing on Twitter was, we cannot say kids are safe when we haven't seen enough to know. And I think we're starting to see now the trickling in of these cases. And unfortunately, when we're talking about truly the impact that we will have with COVID-19, we are just now, I think, in the next couple of weeks to months, are going to see the second wave of this. Because you have to remember, back in January, we only had a few cases in New York, California, and Washington, right? And within weeks, we shut down the entire country pretty much, and we all stayed at home. And even with that much effort, we still have close to 95,000 Americans who have died at this point. Well, we've now opened up the economy, right? Friday, on the 18th, we opened up Virginia. So with that, we now, instead of having a couple hundred people scattered throughout the nation, we now have millions. We have at least 1.5 documented confirmed cases of COVID-19 within America. And so now in every city, in every zip code of every state, you now have a vector that's walking around. And so the true mounting that we're going to see in this second cycle, that's what scares me, because that's what's going to resemble the 1918 pandemic.
So first of all, I'm going to show this here. You don't want to show this photo, but here's a problem. You put this photo on Twitter, so it's a little hard. So you can't, so it's not like you hit make it public. So nice try, Dr. Hilton. This is that. Yes, you did. You put on your Twitter feed. This is that huge mask of yours that looks like you're in Star Trek, that you keep on, you wear it like 15 hours straight, tape down and everything. So nice try. I wasn't going to show it, but since I saw a similar one on your Twitter feed.
Roland, that was, well, we were talking on the
It's
phone.
not?
No, it's not.
It's not? Okay. I'm about to text you a link, and when you see this link that you posted on May 1st, 2020, then you're going to be like, damn, he busted me. All right, so let me, see, baby, Doc, let me explain something to you. I always have receipts. I always have receipts. Always. That's right. Always have receipts.
I was hungry.
Okay.
I was hungry.
Okay. Whatever you want to say. Let me do this here. I got to ask you one more thing, and I'm bringing the panel into this as well. Testing. We're hearing about this Abbott test, giving all these false tests, false positives, false negatives as well. Jeez, what the hell are we supposed to trust out here if the testing is off? What's going on?
Look, if you go back through my Twitter feed, I can't remember the date, but this was several weeks ago as well, where I literally said to Donald Trump, when he was touting these tests, I said, what's the sensitivity and specificity of these tests? Because what I was concerned about was when we privatized this, when we said, hey, private companies and corporations that can make money off of these things, if you get a test out quick enough, we'll be using it. We didn't have a chance to truly validate that through the FDA as we typically would. And so what we're seeing with the Abbott test, for instance, that's the one that he had the box. We all saw it. We had this grandstanding of, oh, this is the new test we're going to use that has results within 5 to 15 minutes. I knew that was going to be a problem. And what we're seeing is that they have false negative rates of upwards of 48%, I think it was. So on average with the COVID-19 test, we know that there's what we call false negatives that range roughly between 10 to usually about 30% is the false negative spectrum. Now, what does that mean? That means, for instance, if you had a false negative rate of 33%, and that means 1 in every 3 persons that tested and they came back negative, they were actually positive. Now, why is that? The problem is that with these tests, it depends on when you're tested. So basically, how much virus are you actually expelling? We call it your viral load. So how much are you producing? It also depends on how this test and sample was collected. So if the person, and when they're swabbing inside of your nose, this Q-tip is about yay long, right? It needs to go directly to the back of your throat. It's not the most comfortable thing, but that's where you're going to get the highest sampling for this test to be valid. And you have to leave it there for 14 seconds as you're twisting it back and forth, and then go into the other nostril as well. And some patients tolerate that a little bit better than others. So it's the timing of when you actually get the test. You can get the test too early in your disease process. You can get the test too late in your disease process. So although you are positive, the test is not showing up as positive. And so that's why we say, as far as your doctors will say, we're using that test as one of the list of things that we're checking off. But if you're symptomatic and your test is negative, we still want you to treat yourself as if you are positive, period.
Jason, actually, I'm going to go to Lauren first. Lauren, that whole point about testing, again, this is the problem that you have. People need to trust that these things are going to work. And what this administration is all about, fast, can solve this thing so the stock market can go up and I can get back to talking about the economy. I'm tired of talking about this whole deal. That's what's driving this. This administration, Donald Trump does not want to take the time to deal with the health crisis. He only sees this thing as an economic crisis because for him, that's the only thing he cares about when it comes to re-election.
Yeah, and I think he also just only sees this as a PR crisis. Obviously, yes, he does see it as an economic crisis as related to him getting reelected in November. So testing gets in the way because now I've got to actually make decisions and I have to lead and make choices about what type of testing, who does the test. Of course, what we're finding is that Jared Kushner was out there, hiring his buddies to procure PPE, hiring companies that they knew. I mean, their whole thing is to funnel money to their friends. So when the motivation is not about science, and the motivation is not about the facts, and the motivation is not about data to save lives in the future, the motivation is about PR and getting elected in November, obviously that's a different set of decisions. I mean, clearly that's a different set of decisions. This president has never taken the lead on how to deal with this crisis and given the states some guidance about how it should be dealt with. You're unlikely to see, for example, a federal plan with regard to how the schools will open either on the collegiate level or on the high school level, and under. And now states are going to have to make those decisions themselves as well, just as they had to do for testing. So it's a lack of leadership. And what it does is it forces state and local leaders to make these decisions. And it will continue until he is out of office.
Scott, if I can't trust the testing, guess what? People are not going to go out. They're not going to go to restaurants. They're not going to do all these things that people are talking about. And that's what it boils down to. This is a multiple thing here. They have to trust testing. They have to trust tracing. I'm telling you right now, look, I've got 2 nieces. There's no way in hell I'm going to send my nieces into a school unless I'm sure they are safe. And so Trump and Jared and Ivanka and all of them can be trying to look. The nation ain't falling for it. Yeah, it's going to be a few folks out there running out to bars and restaurants and going to concerts, but majority of the people, they're like, not when you got almost 100,000 people who are dead. And the thing about this whole deal, which Dr. Hilton knows, this is not like I had sex, I got HIV, and Magic Johnson, who was diagnosed in 91, this is 2020, he's still living. No. These are people who get it, and they gone in a week or 2 weeks.
That's right. Well, if you can't trust the testing, I'll add one more point to your presentation. We're jacked if we can't trust the testing, to be honest with you. And to supplement what the good doctor said, think about the 33%. 10 to 30% are false negatives. That means if you got 1,000 tests, 330 of them are going to have a false negative, right? Which means that you're a carrier. And then you're going to leave and say, oh, I'm safe. So then I'm going to go to those bars. I'm going to say that I'm safe. I'm going to go. And what if I'm a super carrier where I'm in social settings and I'm just passing? It's just jumping from one person to another, like in prisons, like on a ship, or nursing homes, if you will, or on a Navy ship, right? That's the danger of the false negatives. And on the other hand, if you're a false positive, look at all you're going through because you think you have the disease and you're a statistic and you're really not. And so this is really, this false testing is really negative, and it's not really helping us. And then if you get a second wave in the fall, like I said, we're really going to be jacked. It is even more dangerous to false testing than just getting the test and taking it. We got to do something to fix it, starting with Abbott and some of these other manufacturers of these tests.
Jason, real quick.
Yeah, I was just going to say, well, number one, I wish I had the confidence that Ms. Burke had about the election. I'm not so sure that I have that same confidence, even though everything she has stated has been 100% logical and it makes sense. What we learned in 2016 is that Americans don't always think logically. So I wish I had that confidence. I'm hoping to be able to build it by November, but I'm not there yet. And, everything Scott said is absolutely correct. When you, not only just going out to bars, but you're going to go and kiss your granny. You know what I mean? You're going to put other people who are in danger. You're going to go and visit your grandparents or your friend who has diabetes and put them in serious danger. Even if you are a carrier who shows no symptoms, who's asymptomatic, you can put a lot of other people in danger, not just in a social setting, but even if you are quarantined in your house. My mother-in-law is here. She has pre-existing conditions. If I were to get, the virus and bring it home, it could put her life in danger.
That's right.
Dr. Hilton, I do want to ask you this here. C. Elizabeth Warren tweeted today, HHS should be embarrassed by the lazy, incomplete 2.5-page copy and paste job it calls a report on the racial disparities of COVID-19 cases. I'm going to keep fighting until we get this monthly demographic data as required by law. Now, of course, you have that. A lot of people are also just, again, asking these critical questions because what you're dealing with is an administration that is not really giving out enough information. You've had CDC members, you've had state legislators who are saying you have to track this thing with racial data. As a doctor, explain to the audience why it's important to break down this data this way and why you need comprehensive data.
Right. Well, for one, you need comprehensive data in two folds when you're talking about a pandemic. For one, with the testing, the way that we construct vaccines, for instance, is to do sampling of those who have been infected. And if your pool of those who have been tested is not diverse, if it's not inclusive of Black people, white people, Hispanic and Native Americans, then it can really make the safety profile of your vaccine kind of compromised. And that's why it takes so long for a true vaccine to be produced, because you do want to have that diversity of sampling that's had. Now, the other thing is the reason why it's important is because every American and every life matters. And so if we're seeing that certain populations are dying at higher rates, then we need to figure out the why of that. And if you look at it, the very first article, because, I got pretty active on Twitter immediately when I first heard of COVID coming out. And the first journalist that caught wind of that was actually out of BuzzFeed. And they printed an article on me on March the 22nd. And at that time, we had a total of 350 deaths within the United States. So fast forward 60 days later, and we have 90,000 extra. And that's how fast this thing is moving. And even before we had data on this, what I was saying was we need truth and transparency. We need to release the data on who you're actually testing. And at this point, the CDC, they are being very, I think, reckless and not forthcoming in what they're releasing. The first report they had was of 14 states, of which only 2 had a population of African Americans of 30% and greater, and the remainder had as low as 1.2%, like Iowa and Idaho. Why are we looking, if we're truly trying to figure out racial health disparities, then why are you trying to stack the numbers in this case and add the majority of Caucasian heavily populated states to do an analysis? And even of the states they reported, there were only, I want to say, 1,400 total patients that they were looking at. And even all of those patients didn't even have the race and ethnicity identified. So there's a reason why you try to hide things. And the only reason why you try to hide things is if you know that there are things that have been done that is not right. And so we as a nation need to start holding these institutions accountable and say, you must take care of all of us equally. And that means testing, tracing, and treatment options need to be made available to all.
All right. Dr. Ebony Jade Hilton, we certainly appreciate it. Thank you so very much for joining us today on Roland Martin Unfiltered. And folks want to follow you. Where should they reach you?
Well, I'm on Twitter, of course, of which, again, I did not have that picture on my Twitter feed. But I'm on Twitter at Ebony Jade Hilton, or you can reach me on Facebook, also Ebony Jade Hilton. Or on Instagram, it's Jade Hilton.
See, you know what? I was gonna leave it alone. I was gonna leave it alone. But you kept. So sometimes you gotta take this ass with it and you just sit here.
It was a long day.
No. I understand it was a long day. See, now you got me sitting here. I was really trying hard. I had. Say it again.
It was not on my
Twitter. See, you making me scroll through. Okay, switch to this, please. Switch this shot, y'all. Switch the shot, y'all. This is a tweet. COVID-19. These masks hurt, physically leave bruises in your face from the pressure.
I forgot about that.
This is the photo right here. This is the. Oh, you forgot.
I forgot. I was hungry. Listen, that was a long day. I'm trying to tell you. You literally.
Ebony, I got all that. But you said you did not post a photo of you and your mask on your Twitter feed. Scott, did you hear that?
That's not bad.
I don't really remember. I don't really remember what she said.
And I appreciate that.
Lauren, the lawyer don't remember.
I appreciate that. Okay, because I don't remember either. Listen, I was sick and shut in.
Our first responders are working so hard that I think we can give her a bye on this one. I think we give her a
That's right.
No, I ain't giving her no bye because she was so dead. Jason, I ain't never wrong. Jason, she was way too adamant. Hey.
But that picture was a different photo. Wait, hold on a second. That picture was a different photo.
It was. That was more washed out.
Photo, so
but you had.
Wrong.
Thank you,
No. Hold on. Let me.
That's the same difference. Now you caught up in it.
And I object.
Are y'all done?
I don't know, man. That sounds like Trump logic to me, Scott. You know what I mean?
Well,
precisely.
It doesn't fit.
She said.
I said I didn't see that picture.
She said that picture was not on the Twitter feed. The one you showed at first. The second one, she may have forgotten about it, but it was a different picture on Twitter feed. So you owe her damages now, Roland. Do you have insurance?
Right. This sounds like Bill Clinton. This like Bill Clinton trying to see what is. That's what this sounds like. So anyway, we are done. Whatever. You put a photo of you in a mask, I'm going to show you in a mask. Dr. Ebony J. Hilton, we appreciate it. Thanks a lot.
Thanks, guys.
All right, folks. Thanks a lot. Going to a break, and we come back on Roland Martin Unfiltered. I keep telling y'all, Trump, House Republicans, Senate Republicans, Republicans across the country on these states, they're going to do all they can to steal this election, to suppress the vote. I will further explain when we come back on Roland Martin Unfiltered. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. All right, folks. A Texas judge has ruled that people should not have to have a reason to vote, that the coronavirus is enough for them to get an absentee ballot. Don't be shocked if Republicans are going to appeal the decision of San Antonio District Judge Fred Byrie, okay? He laid out the Equal Protection Clause as a reason for it. Now, of course, Donald Trump today was whining, complaining, calling it illegal. He actually said it was illegal what Michigan was doing by mailing out applications to all 7.7 million of its citizens. Here's the problem, y'all. The voters in Michigan approved this in 2018. And what's also funny is that Donald Trump singled out secretaries of state that are Democrats saying this is illegal. But he left out that Republican secretaries of state are doing the exact same thing. Then he conflated sending out, like idiots like Charlie Kirk, conflated sending out an application for a ballot, mail-in ballot, as the same as sending out mail-in ballots. These people, y'all, are absolutely crazy. Let me know if our guest William Roberts is on the line. Is he there? William Roberts, he's the Managing Director for Democracy and Government Reform at the Center for American Progress. William, I have been saying this. I have been covering voter suppression for more than a decade. What you're seeing here is an assault by Republicans. They have actually said publicly what they don't want us to know. The official in Georgia said, man, if we do mail-in voting, we're going to lose everything. That's what we're dealing with. William, go ahead.
Right. No, I mean, you're absolutely correct, Roland. What we're seeing is Republicans trying to weaponize voting by mail, which has statistically not been a partisan issue. For years, both Democrats and Republicans in states around the country voted by mail. And so the Texas case is a classic case of what you're going to see more of, where Republicans are going to try through the courts and through intimidation, like we saw today with President Trump, dissuade people from being able to exercise their right to vote.
And that's exactly what they're doing. And so they already have plans to spend upwards of $50 million to fight mail-in voting. They do not want everybody getting a mail-in ballot.
Right. Yeah, they've announced sort of a national campaign. If I'm not mistaken, they announced it on Twitter, saying that they had a Death Star campaign ready to attack people's rights to vote during the pandemic from home. It is something, as a guest of yours said before, that you would read in the Twilight Zone or see in the Twilight Zone, and it's just really anathema to anything having to do with the principles of democracy and fairness. And you see in state after state, you mentioned Texas and Alabama, and so many other states where state officials are giving contrary opinions on vote by mail because they're following Donald Trump. You saw his tweets today, and I know you talked about it earlier, threatening Nevada and Michigan for the simple act of mailing out absentee ballot applications, saying that it's illegal, which it's not. And so you see this effort going full bore across the country, and folks are going to have to fight it in the courts. Organizations and states are going to be fighting it in the courts, but individual people, it's so important that individuals be able to vote by mail, and also that we start checking our voter registration status now, just to make sure that we are good to go come November for these primaries.
Scott, the reason this is a joke, Ari Berman just hit this tweet out. Top Republicans who voted by mail or requested absentee ballots: Donald Trump, Mike Pence, Melania, Ivanka, Jared, Azar, the Secretary of Health and Human Services, Larry Kudlow, top economic advisor, Wilbur Ross, of course, the Commerce Secretary, Esper, the head of the Pentagon, and Ronna McDaniel, Romney, the head of the Republican Party. So it's amazing. He said GOP only opposes mail voting when Democrats use it.
Exactly, because that should be the Democratic response to any fight against mail-in voting, the list of those names, because Donald Trump said actually on the air that was different, that he had to because he lived in Florida. That was okay. But it is the height of ignorance and the depth of of arrogance, if you will. This argument, they're just grasping at straws right now. And by the way, they don't attack. I was looking at a report today. They don't attack the Republican governor-led state who have sent out ballot applications as well. I think it's either Nevada. You can pull it up. It's a couple of states that were in this report. I think it was the Washington Post that named 2 or 3 Republican governors who had endorsed and sent out ballot applications, which flies completely in the face of the GOP's argument that we're going to fight this mail-in ballot. That Texas jurisdiction or that Texas case, the federal judge there just found it laughable that you want to impose their right to vote at the risk of them being sick. He said it was incredible that the government would make that argument. They're going to appeal it, and they're going to appeal it to the Fifth Circuit, which is historically a very conservative circuit. But even here with these facts and these arguments, there's just really no appropriate legal relief for the states that are going to be doing this. But we'll see.
William, we are seeing, of course, that data is coming out showing the increase in coronavirus as a result of those fools making people go vote in person.
Exactly. That's right.
Exactly. You know, and as Scott mentioned, it is just the height of hypocrisy in states like West Virginia and Iowa. Georgia, I think, is another one where the Republican Secretary of State have sent out applications for absentee ballots, and Trump had nothing to say about it, but he had something to say about it for quote-unquote blue states. And you were right, as our government is unable right now to contain the spread of the virus, flatten the curve. What folks are asking for is common sense, right? Just to allow people the ability to vote from their homes, to vote from a safe place and not have to go out. Because we saw, and we've talked about this before, in Wisconsin, for instance, where we've tested this experiment out already, right? Where people had to risk their lives to go out and vote. And we saw where state systems were inundated with requests for absentee ballots, didn't have enough time, perhaps, to send them out to enough people. And so you had people receiving ballots after the election, et cetera. This stuff is, they're overly complicating it on purpose, right? Because this is not ignorance. This is a strategy designed to make it so that people can exercise their right to vote this November. We've got to push against it. We've got to fight against it in state houses. We've got to fight against it at the federal level. We talked about we need that additional money for mail-in ballots and these future coronavirus packages. But we got to be really, really clear-eyed about what they are doing. It's a concerted effort to stop people from exercising their right.
Yeah. Hey, Roland.
In fact, Lauren, I'm reading something here. So Kayleigh McEnany said today, this is her trying to defend this nonsense. She goes, you can go look at this up on ProPublica. There is a bipartisan consensus on that mass mail-in voting can lead to fraud. Now, what's funny is that Jessica Huseman, who wrote the story, hold on, Jessica Huseman, who wrote the story, said, "Hello, Press Sec. Thanks for citing my work, but I wish you had put what I wrote in context. The article says all forms of voter fraud are rare, including mailed ballot fraud, and it describes specific steps that states can take to minimize any issues." I call that a clapback, Lauren.
Yeah, pretty good clapback there. Katie McEnany is a pathological liar, which is why she's the director of communications for Donald Trump. It's actually a perfect fit. With regards to the tweet that you referenced from Ari Berman, that says it's absolutely insane, Texas Republicans taking position that people under 65 can't vote by mail because of COVID. It's actually not insane. It's Republican policy. And it's been Republican policy to make it difficult for people to vote for years. There's nothing new about this. They have no longer been the party of adding people to the party or trying to do things to add people to the party or trying to do things to convince people that the Republican Party is better than the Democratic Party. Their entire strategy is to have a base election and then stop Democrats and Democratic constituencies, Democratic base constituencies from voting. That is their strategy. There's nothing new about this. This is what they're going to do. Russia's probably going to help them again. And they are no longer a party trying to attempt to convince anybody of anything, really. They're just trying to go their base out and stop other people from voting. And that's what this is.
Jason, your thoughts on, again, what we're seeing and that I think is just going to continue between now and November. They're going to attack at every turn.
Yeah, no, I 100% agree with everything that's been said. I think even not bailing out the U.S. Postal Service is a means of trying to keep this from happening, because they see that mail-in voting is going to be a big part of the election. I think that, they're going to do everything they can to suppress votes and to keep people from voting. The smaller the pool of voters, the better Republicans do. The larger the pool of voters, the better Democrats do. And that's always been conventional wisdom for the last half a century plus. So I think they're going to try the same kind of things, the same kind of dirty tricks. We know that more people, like in Florida, over 1 million people who have been convicted of felonies are now re-enfranchised. They have to do something to truncate that, to keep those people from voting. And so trying to stop mail-in votes is one aspect of that.
All right. William Roberts, man, we appreciate it. Thank you so very much. You guys will stay on top of this, and so of our civil rights organization, so we look forward to the work continuing.
See you next time.
All right, sir. Thanks a lot. Folks, this crazy story out of Georgia. 11-year-old Skylar Davis from Aiken, Georgia, is speaking out about being assaulted by a white woman who thought she was stealing her mail. Skylar was picking up her grandmother's mail when she was attacked by Elizabeth Shirey. Now, trying to figure out why this is going on. We're about to talk to the attorney for Skylar, Justin Bamberg. Once he comes on, we'll definitely. Is Justin there?
Yep, I'm here. Can you see me?
All right. Yes, Justin. Looks like you're there with Skylar, correct?
There we go. Sorry about that.
All right. So gotcha. So we have. Is it just you, or is it you and Skylar?
It's just me.
Okay, gotcha. So Justin, what the hell? So she attacked Skylar because she was picking up mail?
Absolutely. It's utterly ridiculous. Effectively, man, her grandma asked her to go to the mailbox, and she does. She gets this mail, and literally, this 38-year-old white lady sees this child standing by her mailbox. She presumes, of course, she has to be a felon, and she stole it. And she rolls up on her and assaults her, man.
But see, this is what I keep trying to tell people. We're operating in this space where white folks think they can just do whatever to black people and no repercussions.
Yeah, that's a very, very big problem. To make matters worse, Roland, after she realized that this girl was completely innocent, she offered her cookies. I've seen some people refer to her as the Cookie Monster. I think people just need to realize they don't run the world. They're not God. And they need to quit prejudging people. We've seen you can't dog while black. If you're Ahmed Arbery, you can't eat ice cream in your apartment while black if you're Balkan jeans. You can't apparently get the mail as an 11-year-old child while black. And this is ridiculous. And I can't help but think, having been involved in the civil rights arena, if you think back to Trayvon Martin, if you look at Torrance Thomas and Raleigh, right, what's going on right now in Georgia, there's an uptick lately, and I can't help but think that it's coming out of the White House. People are emboldened like they haven't been in a while, and a lot of it is because of what Donald Trump spews out of his mouth in D.C.
Well, so where does the case stand right now?
Where we're at right now, things are just pending in the criminal justice process. The lady has been charged. We're fortunate that she was charged that very day. And we're waiting on it to run its course. A big part of this, and I asked Skylar, I said, Skylar, were you scared? And she said, no, not really. You have two choices you can make. You can be afraid, and that leads to fear, and you run. or you can face your fears and rise above. So a big part of her standing up is literally to let the world know that at 11 years old, she understands that this is not right, but she's not going to let this defeat her. She's a straight A student, Roland. She's a part of the Duke TIP program. You know, she shouldn't have been attacked, but she's not going to let it beat her. And I hope this woman, this criminal who assaulted her, is embarrassed. I hope that it's uncomfortable for her, because we've got to start making examples out of people who cross the line, who judge minorities, right? Even if you don't kill them, right? In this instance, this is an assault, but nonetheless, an injustice is an injustice.
All right, Attorney Justin Bamberg. We surely appreciate it, man. Thanks a lot. Keep us updated on this case.
Absolutely, and 06 to you, Roland.
All right, I appreciate this, Scott. I know Scott Bolden is sickened by that because it's a little hard. It's a little hard for him to handle.
His interview is over. Your interview is over, sir.
It's a little hard for him to handle. It's hard for him to handle all the alphas on here. Lauren, I'm gonna go to you on this one. I'm telling you, Lauren, these white folks out here, Lauren, really are losing their minds. They are losing their minds.
Yeah, well, I mean, you know, it's a matter of people thinking for some reason that they have agency to do whatever they want with you, question you. To me, the ultimate example was Trayvon Martin, although there's been so many other examples of people that think that they're the police over you, they can tell you what to do, which, of course, is nonsense. And I got to say, a day after Malcolm X's, what would have been Malcolm X's 95th birthday, I mean, his attitude, I think we need to really think seriously about adopting a lot of the things that he was saying. Because if people are thinking somehow that they can control what you're doing and your behavior, that's what makes them do it again and again. What dissuades them from doing it again and again is when you clap back hard. And so part of what we're saying is we're too nice sometimes, quite frankly. Well, you had a guest on your show. This topic had come up before. He had said that we should be the ones calling the police. And that's true. I mean, like, what is this?
Although that's dangerous for us.
Well,
that's dangerous for us to call the police, Lord.
Yeah, well, maybe so, maybe not. But I'll tell you what, this disposition that we have, that's all good and it's all, you know, it's fine and no big deal. That's what I think kind of, in some ways, not to blame us for other people's stupid behavior, but that's what sometimes I think, what makes people think that they can ride up on us with nonsense.
Well, yeah, but they don't need really a reason. You know, the real dangerous part of this case about the 11-year-old just getting her grandmother's mail is really what could have happened and what we've seen happen before. What if this young lady had gotten her grandmother's mail and ran from this white lady, right? And then she had gotten a gun and chased the young girl. I mean, we've seen instances that have just been that crazy, right? One pending right now with a Meds case, and chased her into her grandmother's, or called the police and said this had occurred, and the police come, and the police are abusive to the grandmother and others in this home. This is the real danger of just this, or the woman being charged with assault. And the danger is that everything that I've said could have happened, we've seen in reality it happen, including the loss of life. That's the biggest reason why this has to stop, whether we clap back harder, whether we call the police, whether we arm ourselves, whether we avoid situations, because we know how bad and how tragic it can turn out. This is not some fantasy. This is our reality as African Americans in this country, and there's something really fundamentally wrong about that in this country, given our constitutional rights, and that are constantly being violated or challenged.
Well, you know, one thing I think's really important here, when you mention fighting back, is even sometimes, if you look to the case of Brian Hayward, for example, he was shot by a Charleston County deputy. That is a case that myself and Chris Stewart handled. He was an innocent homeowner, you know, a 20-something-year-old African-American male. His house was being burglarized, and he is on the phone with 911, and when the deputies arrive, they instantly think he's the burglar, and they shoot him. And he's paralyzed now for the rest of his life. You know, so, yeah, you've got to be careful. You've got to be careful getting the mail. You know, you've got to be careful jogging. You've got to be careful calling the police. And the bigger question is, you know, how do we fix this outside of accountability? You know, do you go for DAs like they're doing down in Brunswick? Do you go for individuals who do little things like simple assault? Do you keep going for people who commit murder? I mean, that is where I think the bulk of the discussion has to be is where can we fix this?
Yeah, but I don't think we're going to fix it through the criminal justice system. I'd like to think so because we're fellow lawyers. But the reality is that white supremacy is taught. We're not born with it. White people aren't born with this white supremacy gene or this racist gene. And so the socioeconomic and physical factors and results of white supremacy is what we're seeing the manifestation of. And so we got to start early and often with having a really thoughtful national dialogue on race relations and getting some level of comfortability between all of us. Now, that may sound broad and grand and what have you, but it's not. But it's not that unrealistic because everything else we tried certainly hasn't worked. We're still in a bad place with race relations in this country.
Yeah, we very much are.
Folks, I got to go to a break, folks. I'm going to pull up Teddy Riley next, and so I certainly appreciate both of you. First of all, Justin, thanks for being on the show. Scott, thanks a bunch. Lauren Victoria Burke, thanks a bunch as well. I will see you guys next time. Folks, going to a break. When we come back, we're going to talk with Teddy Riley. We're going to talk about technology and something he's doing with a black-owned site that's actually a boon for black artists when it comes to streaming their content. We'll discuss next right here on Roland Martin Unfiltered. All right, so a lot of y'all always asking me about some of the pocket squares that I wear. Now, Robert don't have one on. Now, I don't particularly like the white pocket squares. I don't like even the silk ones. And so I was reading GQ magazine a number of years ago, and I saw this guy who had this pocket square here, and it looks like a flower. This is called a shibori pocket square. This is how the Japanese manipulate the fabric to create this sort of flower effect. So I'm going to take it out and then place it in my hand so you see what it looks like. And I said, man, this is pretty cool. And so I tracked down, it took me a year to find a company that did it. And so they make these about 47 different colors. And so I love them because, again, as men, we don't have many accessories to wear. So we don't have many options. And so this is really a pretty cool pocket square. Now, what I love about this here is you saw when it's in the pocket, you know, it gives you that flower effect like that. But if I wanted to also, unlike other, because if I flip it and turn it over, it actually gives me a different type of texture. And so therefore it gives me a different look. So there you go. So if you actually want to get one of these shibori pocket squares, we have them in 47 different colors. All you got to do is go to RolandSMartin.com/pocket squares. So it's RolandSMartin.com/pocket squares. All you got to do is go to my website, and you can actually get this. Now, for those of you who are members of our Bring the Funk fan club, there's a discount for you to get our pocket squares. That's why you also got to be a part of our Bring the Funk fan club. And so that's what we want you to do. And so it's pretty cool. So if you want to jazz your look up, you can do that. In addition, y'all see me with some of the feather pocket squares. My sister, who's a designer, she actually makes these. They're all custom made. So when you also go to the website, you can also order one of the customized feather pocket squares right there at RolandSMartin.com/pocket squares. So please do so. And of course, it goes to support the show. And again, if you're a Bring the Funk fan club member, you get a discount. This is why you should join the fan club. All right, folks, every Wednesday here on Roland Martin Unfiltered, we have my technology segment. What is our goal? Our goal is to get our people focused on technology, show them some things they may not be aware of, and be able to speak to these larger issues in terms of us being able to control our content, or run everything. So when they had the versus battle between Teddy Riley and Babyface, oh, Lord, everybody was dogging Teddy, saying that he was wrong, he was doing too much. But I did a video, I was like, nah, I said, I see what Teddy was trying to do. because Teddy Riley had complained about the limited nature of Instagram and what you can and cannot do. And so when he and I caught up on the phone, we talked about it, and he shared with me some things that he had done with Blackstreet with his black-owned platform called Omnis Player, OMNISPLAYER. And so this is the website. This is the web interface right here. And so if you go to the site, this is what you will see right now. OMNISPLAYER. And so what you'll see there, you will see they have these live stream concerts, video on demand. Teddy Riley has one. They have one featuring Keith Sweat and Blackstreet, Melissa Etheridge, Snoop Dogg as well. Joining us right now is Teddy Riley. Teddy, how you doing, man?
Wonderful, wonderful. How you doing, Ro?
Man, great to see you. When you and I talk, I really love this because, again, when you're at the initial battle, man, you had the cameras, you had all this sort of stuff, you had everything that was there, and people like, oh man, but everything sounded fine on his website, and he was doing too much, but they didn't quite understand that your vision was actually bigger than the versus battle.
Yeah, it is. And I have to say it is because, but then it was, and we didn't take advantage of it, and it didn't cost anybody anything. I don't believe in charging my people, especially around a time like this. If I can do free concerts, I'm going to do it, you know, and it doesn't matter, you know, we will, you know, prosper on the other side if we can. If we can, it's fine. As long as we got the fans what they wanted, and that's what I wanted to do. You know, technology, we don't have a control of technology unless we do it ourselves.
And the thing we were talking about here is that what you were doing was being able to provide it on the website, because what you saw between you and Babyface, that was content. That was, and so why just limit the content just to the two of you on Instagram? And then what this also is about, being able to tap into it where you also are controlling data. You'll be able to have people who are coming back. Now, with Omnis Player, people are able to, your concert on Mother's Day, I saw Silk and Keith Sweat on there as well. And what's interesting is that all these artists out here are doing it. There's another company out here, I'm gonna bring it up in a second, where they're doing these live concerts, you know, for artists, and they're making money. The lion's share is the money. Your whole deal is like, no, black folks and the artists should be making the lion's share. So here you are, black artists partnering with this black company doing this live stream, and both of you are getting paid, and not just Facebook or Google or folks at Twitter and other platforms.
That is true. And I want to point out, because it was said, you know, the fans were saying, you know, Teddy Riley want to charge us now. You know, I did the Blackstreet concert and I didn't charge. And I wasn't never charging anybody for a concert. You know, I just want people to just come and enjoy. So I wanted to point that out. Nobody else is doing that. Everybody wants to charge, and it's just not my way of giving back, you know.
And so what this is so basically, explain to people how Omnis Player works and how these concerts, video on demand, work for the consumer and then work for you, the talent.
How it works is, you know, each, like your platform could have a channel on Omnis. You still own it, you know, and basically what we do is we share in the profits, and we're giving the actual the consumers and everyone out there, they getting to see it for free, where it doesn't take anything from them. And on our side, we're able to share in, but also have the advertisers and then pay for the instances. We're doing this all ourselves, but we're not taking anything from the actual viewers and the fans.
And the reality is that these are dollars that you're generating, the artist is generating. You're not having to sit here, like, for instance, Erykah Badu, when she did her initial concerts, she didn't really she did everything on her own. Variety had this great story where she talked about her Wi-Fi was weak in her home, so she had to bring in a satellite. She had the company she called the back-end company to handle the purchasing. And so the first concert she did was $1. The second one was $2. Then it was $3. And it was all of these different things going in. What these guys have created is a all-in-one suite where it's 50-50, where they're handling the production and the streaming. You handle what you do. That is promotion and singing.
That is true, and that's how everybody's deal will be, where they're able to bring in their content and put it up on their website. We actually utilize their website, so it's direct to the actual headquarters and direct to the actual service. And then pretty much they go from there. They could show what they would like or whatever content that they want to put up.
What coronavirus has done, it has really forced a lot of artists to really focus on how they do a lot of this stuff themselves. There are people out there who say, look, I don't deal with that. I got staff dealing with that. Well, here's the problem now. People are sheltered in place. Folks are in homes. I've had conversations with many artists and DJs and rappers and others who are like, hey, Roland, look, you've been doing this digital stuff, and so what piece of equipment to use, what camera to use, what mic to use. And so, look, we're not going to be moving towards where you're going to be having tours anytime soon. Yes, some states are opening up, and so a lot of artists are really going to have to think about how they can earn a living, as well as for the band members and their families in this whole new age of coronavirus and really utilizing live streaming.
That's true. And I always urge the artists to, get with us. You can actually create content, because I know you have other artists and people you want to bring on. So I got a bunch of friends that, including yourself, we spoke about it, and I said, man, I'm not a middleman. I just want to put everybody together. I'm a part of the company. I don't get a huge share of it when I bring people in. I just get, just find this type of share, and I'm good. But, 50% of something is better than 50% of nothing. And I think that all of the artists should come out, all of the artists should, and comedians, everybody content makers. You write poems, you write books. Everybody could be on this network, and we're not the only network. We're not the only channel. We have another channel called Vuzu, and that's another channel that I have my partners there as well. So I'm not exclusive anywhere. I'm able to put it anywhere I'd like.
And as you were talking, I mean, I could not help but think about Prince when he talked about owning your masters, when Ray Charles talked about that, Sam Cooke, Harry Belafonte, owning your own publishing. People forget Prince had a download service on his website before iTunes even existed. And so now what we're talking about here, to your point of artists having full control over everything about them and being able to generate substantial amount of dollars. And guess what? You're not hopping on buses and planes and traveling and having it. You're doing it right, frankly, from facilities. Your job is to actually to push and promote it to get your fans to come watch.
That's exactly what it is. I mean, we also have it where we can target the demographics. So we can actually, we know exactly the first people who bought the first Guy album or the first Teddy Riley record. And we can target them because they're the first to buy it. But we can target somebody every, the month of your birthday. Everybody in the month of your birthday. And that's how strong the system is. So I think if artists come along, they would be able to target their fans, the fans that bought their first records and new fans.
Well, what I find to be just really interesting about it is that you see what's happening right now, and I get it. Because look, let's just understand. Look, we're streaming this right now, and we're streaming on YouTube Periscope and Facebook. And for the people who might be saying, well, Roland, why are you doing that? It's because also I studied the models. What I also understood is that when you step out here and you're streaming, you're actually paying broadband cost. And so when we launched, I need to keep the expenses very low. So by streaming on these platforms, they are assuming the bulk of the broadband cost. And so that was a strategy behind it. It also was to build up the show, build up the following. And so when I reached a certain point, and and my goal was, I said no later than year 3, was to then take the audience that we built up and then shift them to another platform to say, y'all like this content, follow us here. And so what you're basically saying is, with the people who follow you on Twitter, on Facebook, and Instagram, hey, you want to see a live concert? Let's just go to Instagram, where frankly, the people who are actually making the money is Facebook, because they own it. Your deal is, let's move our audience over here, and now we can build a black-owned platform. We can get paid, and to your point, you're still not charging the consumer. It's a win-win across the board.
That is true, but at the same time, just so people know, you're not taking any money away from Instagram, because you can still have your traffic come through. Whatever traffic comes through, right, they still make the money from it. It's all about the instances. And I just learned about the instances. And what that is it's basically the click in, click out, how many instances that's coming in. So the reason why the actual thing happened with the battle was the instances got, it's just like bombarded. It's almost like the fire marshals came and said, this is it. No one else could get in. So the instances was up to 500,000 for that particular, event. And then they opened it up, because, sometimes when it comes to certain demographics and when it comes to, say, R&B, see, no one thought that Babyface and myself will flood, and break the internet. So you're right. You have to pay for the instances. You have to pay for the broadcast, and it's according to your instances. And what I learned also, I had over so many instances. They said for the battle, it was more instances than the Kobe Bryant memorial. I was like, no, that's ridiculous. Not Kobe Bryant. So I just learned about that. We have more instances than that, because people, it depends on where people want to go. So if you're going to Instagram, you're going to go to Instagram to see if we're doing a concert, or seeing if Roland is going to be on there, or whoever's going to be on there. That's an instance. So that's what, that's why I said we're not taking money out of anybody's mouth. We're just basically adding on what we own. We're controlling what we own, the content. Because once it gets on there, then it's theirs.
Right. And the thing that I think is important is just understanding. Black people are the tastemakers in America. We are the trendsetters. We move culture. We shift culture. And what this is really saying is that, look, we over-index on these. We over-index on these. And so we're early adopters on apps and different other programs. And so what you're doing is trying to get us into the frame of mind of not just thinking that we are consumers, but that we are owners.
That is true. 100%, man. And like I said, I'm not late in the game, but knowing what I know, I was like, man, let me apply not to the music and playing the music, because we know how to do that. But let's get into the business aspect of it, because, for so long we've never gotten into it. And now that we know it, we all got to jump on board, because this is going to be the model. This is going to be the model. You're going to have to figure out how to make money from home. And, it's just by the push of a button and getting into different businesses. People are doing it every day.
the guys you're working with? I mean, how enlightening has it been for you? I mean, look, you know music, you know artistry, you know producing, but how enlightening has it been for you learning a whole different aspect of technology?
It's like going to school all over again. I mean, just all the things that you need to know, and the next thing you know, something new comes up. Because this is a model that things are going to change. Just like, you know, the 2G to the 3G to the 4G to the 5G. So you got to roll with that. You know what I'm saying? You can't hate on it because it's going to happen. So how do you work with it? That's what this is. And I know that, you know, the model is just going to grow and new things are going to happen. It's just like us going from the iPhone 1 all the way to now going into 11, 12. So we got to roll with that, and we got to learn this. This is not hard to learn, and it's not hard to have content. You know, people from overseas and people, manufacturers are looking for partners. We can sell pretty much anything, clothing, and we do that well. Let's put it online. But own it.
What has it been like? What has it been? So what are the conversations been like that you've had with other artists? Are some afraid for the leap? Are some excited? Have you had to show, now folks, this is what you can actually make from this? What have those conversations been like for you?
Well, one of the conversations, I don't want to say the person's name, but he had to see what I was doing first before he jumped in. And then when he seen what we were doing and he seen the numbers, which I can actually show you just from the Blackstreet numbers. I could pull this up right now from the dashboard, you know, so you all can see right here. Let's go into, all right, here we go. I'm just gonna show you the instances for Blackstreet. So you see this number right here? If you can see that. Let me know when you can see it.
It's actually a little white out. Just go ahead and read it. Just tell me what it is. Now I can see a little bit.
557,525.
Wow.
That's just on the first round. Now you slide this over, and on the replay, there's another 200 and something thousand. So I can tell you those numbers add up, and you have the control of those instances as long as the company that you're working with are willing to partner with you to pay for those instances and pay for the services of getting your video and your content up. You got a good partnership, and that's what I have. I have that with Vuzu, and I have that also with Omnis. But you know, Vuzu, I have more of a partnership. You know, I have to say, I have more of a partnership, and those guys are not just technology guys. They're from the record industry. So I just want to introduce this to all my friends, and that was my conversation from the first person. So when he seen that, he's like, I'm jumping on board. And then, you know, we started putting our own money into it because you're gonna have to. But there are some things that you don't have to, just to get it up online and control it. You know, there's ways to get it up there, but get a great partner.
Yeah, like look in our case. I mean, I've had a conversation with those guys, and you know, I said to them, I don't need your production stuff. I already got my production stuff. You know, I'm like, we already have that. You know, so it's right. So it's understanding, you know, the levels of partnership. And I think, you know, one of the things that's very interesting is that, you know, when I did all these videos complaining about the sound issues, I've talked about different adapters. You need to use this system over this one. What's one way, what's two way, how's audio being compressed. What's real interesting is that the number of, I've had all these different black tech companies who've been reaching out, who are like, dude, we didn't realize you understood this stuff, or we didn't have a platform to talk about us in this space. And so we've had folks on every single week for the last 4 weeks or so who are black people in technology, who are saying, hey, we have the opportunity to create our own space and control our own content and be able to make money. And that's one thing I think has been great that's come out of this. And even though folks have been cracking on you, and all of a sudden if they get some bad audio, they like, uh-oh, they got that Teddy Riley audio. Exactly. Teddy Riley is laughing with them to the bank.
It's a beautiful thing, man. You know, I'm glad because it still, you know, keeps us out there, keeps us trending, you know, and you know, I'm going to keep doing what we need to do just to get us to the forefront, you know, but at the same time, I'm not into taking food from anyone. You know, Instagram have been supportive to me, and Twitter and Periscope, and I'm going to be still using those, but those will be, you know, you got to come through, how they say, the ticket booth. Well, you got to go through security and then go through the ticket booth, and then, you know, then you're in the door. So I don't have a problem with that as long as I can control what's inside the door.
There you go. Teddy, great conversation, man. Certainly good luck with it. What you got coming up next? What you working? What's next?
We got a concert this week. We got 112 and next. You know, I joined Keith Sweat and iHeart. So we're looking at joining them, and we're just trying to build a bunch of partnerships. You know, we also talking with Dash, you know, just to see what we can do. But iHeart looks like they're going to be the ones to take this thing where it needs to go. And thanks to Keith, you know, having his relationship with iHeart, we're able to have something there. So that's going to give us radio, and it's going to give us visuals, which covers what we've been wanting to cover for the longest, you know, as artists, as content makers. We were either getting radio and no TV, no visuals. So now we can get both. We're able to show both.
All right then. Teddy Riley, man, we appreciate it. Keep handling your business, and we'll be there watching.
Thank you, man. I'll see you there.
Yes, sir. Appreciate it. Thanks a lot. Going to a break. We come back. I guess we'll have some laughs with Chris Spencer. He kind of funny. Wild Out Wednesday next on Roland Martin Unfiltered. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. You want to check out Roland Martin Unfiltered? YouTube.com/Roland S. Martin. And subscribe to our YouTube channel. There's only one daily digital show out here that keeps it black and keep it real. It's Roland Martin Unfiltered. See that name right there? Roland Martin Unfiltered. Like, share, and subscribe to our YouTube channel. That's YouTube.com/Roland S. Martin. And don't forget to turn on your notifications so when we go live, you'll know it. All right, folks, every Wednesday is Wild Out Wednesday. Joining us this week, my homeboy, Chris Spencer. What up, Chris?
What up, sir? How is you?
Man, glad to see you, and trust me, there are more people who are watching us right now than who are watching most of those IG Live videos these people are calling you to do.
God, that's so disrespectful, but they're trying, okay? They're trying.
But Chris, come on now, Chris, you got to admit, you're sitting here, man, folks trying to have you on for 15, 20, 30 minutes, ask you to do an hour, and there are 11 people watching.
Right. How many we got today?
Oh, well, right now, we've got more than 2,000 who are on YouTube as we speak. Let me click on over to Facebook. We got more than 300 on Facebook, I think, and then we got another. Because what happens is, so let me explain technology for you, because I know that you're a step up from Buddy Lewis. That's not saying a lot. So the deal is you're on FaceTime. Right. And so what's happening is you're on FaceTime and you're routed through our switcher to send your signal out. And so I'm on another signal. And so that's why, so unlike, so that way it's not like you can actually see me because we're routed through a switcher, which is going through our encoder, which is sending the signal out to the audience. That's a bunch of stuff you have no idea what the hell I just said.
No, I have an idea. Okay, I get it.
Yes, that's what's going on. So just like when you do a television show, just look straight into the camera and talk and ignore being able to see me.
Okay.
How is this? Are you ready to wait? Are you ready to run away from home, or has it been good kicking it with the family?
It's been excellent for me because yes, we've gotten closer. I think my wife proposed to me again because I'm home so much. But more than that, I actually had work. She's like, I'm like, I can't kiss you no more. That was okay, good, that's great. This is lovely. Yeah. Okay, good. I want to watch them. Okay, I get it. So she loves it. I actually had work to do, so it was great that I actually couldn't be, sneaking off the golf courses and stuff. I had to actually finish these projects that were, I was hired to do before COVID started. And
what's crazy is we were texting the other day, and you were like, you know what? I think after this, I don't think you even want to hear the song Zoom.
Right? Yeah, that's the only song from Teddy Riley I'm not going to hear. All I want to do is zoom, zoom, zoom. I got to go right past that one.
That one and the Commodore Zoom, because you have gotten sick and tired of these Zoom meetings, correct?
It's just unnecessary. Like, I understand if there's a board meeting, 30 people, whatever, but don't be one-on-one Zooming me, okay? I don't, just call me, pick up the phone, text me. But I was getting mad too. I'm sorry.
No, go ahead.
No, I'm just saying, in the beginning, I understood because there was no human contact. Like, I even found myself FaceTiming the gardener. He'd be up front, I'd be like, hey, what up? And so I understood, but now it's over, okay? Just call me, text me, do whatever you did before. Too much.
Dude, I was on a Zoom call, and they were like, Roland, we hear you, we don't see you. I'm like, yeah, because I'm calling into the Zoom call. And they're like,
see, you're not going to be on video? You was prepared for this.
No.
Matter of fact, I wish you would have told us this 4 years ago or 5 years ago when you started doing your own stuff.
But I did. I tried to explain to people.
You should have been Chicken Little going, the sky is falling. Y'all need to take a Roland Martin technology class. Cash at me at Roland Martin.
Dude, I tried to sit here and explain to people. It's like, so for instance, so I had a Zoom earlier today, and actually it was a criminal justice panel that I got paid for. And so I was perfectly fine with it. And so I couldn't go into the studio. So right now I'm here in I'm at my house, and I have a studio in my house. I've got a green screen behind me. Right. I've got the lights, the external camera. I've got a ATM mini switcher monitor. I'm like, look, I'm just like, look, I'm like, I own my shit. I got microphones. I'm like, look, dude, I'm sorry.
You were prepared for this.
Yeah, so that's why people are like, oh my God, how does it feel being at home? I'm like, I'm good. I've had so many. Normally, I have 3 to 4 suitcases that are in different stages of either need to be unpacked, need to be packed, or that's the trip from 2 weeks ago. So I've been good.
Right. This is great for you.
The golf game has suffered tremendously, but we can get that thing back. We can get that thing back. So we can get that.
Listen, that's one thing I won't talk bad about you is your golf game. You can play.
Hey man, somebody got to do it. So, so last week you participated. Ceek had this virtual reality comedy deal. You did that. What's been the craziest thing that somebody has asked you to do during this whole coronavirus deal, where you went, seriously, you want me to do that?
Any invitation to do stand-up I've turned down. I'm not going to be doing stand-up to my screen. to my screensaver. It's just too awkward. You know, music is different. You play the song, you wait to the end, or you play the song and you can rock to it. Comedy, I need to feel that interaction every few seconds, minutes, to help me elevate my game. Now, there's some people who are straight monologists, and it's not about the crowd, and they're rote with their material, and that's how they are. I love the energy of the crowd. Something in the crowd might take my material in a different direction. I need to feed the people, feel the people, and see the people. I can't just do robot stand-up to a blank screen. I can't. Although I did do it last week for a lot of money.
So how are you going to operate, man, now in this different space we're in now, where we don't know if we're going to be back in comedy clubs or doing concerts or, you know, the award shows you write for?
I got scripts. I got scripts. I gotta write. Yeah, so I'm busy. So I was never the road warrior anyway. I wasn't on the road like a DL or a Bruce or a Michael Collier, Mike Epps, who were 40 to 50 weekends, Mike Epps, Kevin Hart. I do about 10 to 15 dates a year, and so it really hasn't affected me much. Of course, I like going out of town, some of those funky cities. You know, the things that I host, the American Black Film Festival and the Black Enterprise situation. But other than that, I got scripts. I got work to do.
Do you think coming out of this, when stuff does fully open up, that comedians are just going to be on fire because stuff has just been building and building?
Absolutely, because tragedy plus time equals comedy. So there's going to be a lot of people doing the same shit for a while. So they're going to have to sift through the tissue jokes and washing their hands every 5 minutes. But, like, I got one joke I'm going to do, and I know everybody's going to steal it, so I'm going to tell it to you right now, right? So this is a true story. I was on the phone with one of our good friends, Anthony Anderson. I was in Whole Foods. I was masked up. And he said something, and it made me laugh. I laughed, and, you know, sometimes you laugh and cough. I laughed, coughing.
Right.
The lady looked at me like this. I go, ma'am, don't worry. This is not COVID. This is just regular old AIDS. Just regular garden-of-mill, over-the-counter HIV. You don't have nothing to worry about.
Damn. Yeah. That's
so
the reason that's funny because earlier
and you're gonna hear somebody steal it. I promise you.
Well, the reason that's funny because earlier in the show I was talking about. I was like, "Yo, what makes this thing different is that if you go sleep with somebody and you get HIV, Magic got diagnosed in '91. He's still here.
Fantastic looking.
You got somebody cough on a bus. The bus driver, the brother in Detroit, he was dead 2 weeks later.
Right.
This ain't a virus. This is a virus.
Yeah, this is like in the movies virus. Contagion.
Yeah, this ain't no joke.
Yeah,
this is no joke at all. No joke at all. I gotta ask you this here. So, what's this thing you and your wife doing? This date night? What's that?
Yes.
Who idea was that?
I don't like the tone of your voice. How you're asking. I'm sorry. I'm not using ATM switchers and shit to make it look fantastic. But
So the reason I asked that because when y'all were on live and I popped on and I was just trolling and you had a look and I was like, look at Chris. He don't even want to be there. He is there. I said, Chris. Chris Chris looking like Patty Hearst. He's been kidnapped. And your wife hit me, Roland, I saw your comments. Chris was not being kidnapped. He was a willing participant. I was like, yeah, right.
Yeah, except he didn't get to participate. No, it's a talk show. You know, it was something that we sold to Kevin Hart's company and Sirius Satellite before this COVID situation happened. And so we had to sit, and we were like, yo, we see all these other people doing these other platforms, doing things on Facebook Live, Instagram Live, YouTube Live. And I was like, this is perfect practice for us. We've never worked together. You've never really done anything in this capacity. So boom, now we get to be in junior college where with very small visibility, we can figure out how we work together. And then when it's time for us to get on the air, boom, we've had practice.
Gotcha. So basically what you said is you're going to be a guinea pig right now. And then if we figure out that we don't like working together, we just won't do it later.
You are so good at this. Yes. Exactly. If this don't work out, you'll be replaced by Rosario Dawson.
Last question for you. Yes, I know you got to go. You got to go do a.
We got date night tonight. We got 15. Rodney, we got Holly Robinson, Rodney P.
Y'all do.
Yep. And we want to get you on right
what time?
Too. 6 o'clock.
What time?
PST. 6 p.m. PST.
Oh, so it's 9 o'clock Eastern. 9 o'clock Eastern. Got it.
Yes.
So I got to ask you this: has there been anybody who you did not know about before all of this, where now you like, oh my God, that person is crazy funny or really talented, or I really like hearing from them? Like for me, it's Spice Adams. I had never heard of Spice Adams before all of this here.
Yes.
I didn't, and I would see him with in D Nice in Club Quarantine, and then I start seeing these videos, and then first of all, I gotta remember he's an Omega, so I really wouldn't give a damn about knowing about him beforehand. So I really wouldn't. But now, now I know about Spice Adams as a result of coronavirus. Anybody for you?
I can't top that. That dude is a genius. I knew about him before. I've seen him around. I've done events with him, but I was watching him slowly creep up with the Cat Daddy stuff and the old school dude doing the 4th of July picnics. And I don't know if you remember, he did that NBA basketball commercial like 3 or 4 years ago, and I was like, "Who is this dude?" So he was one.
Hold on. So he was the one who couldn't. Hold on. Was he the one who couldn't shoot? Who did
had the orange on?
Right.
On the garage. That's Spice.
Got it. Well, because he was at.
Heavier. He was sugar and Spice Adams. Yeah, he was a little heavier.
So there's nobody who
Spice Adams.
Damn. See right there. See now. He gonna hit
and syrup.
Damn.
No, you can say that.
Damn, you ain't right.
Talk about a person when they're heavy. You can talk about them after they've lost the weight. Then you can do a heavy joke. I can't talk.
Look, they don't care. Right now, if they getting paid a certain amount, they don't care.
They don't care.
They don't care.
Why would they?
All right, so it looks like, just so y'all know, I'm talking right now. I've lost my Skype, so to the studio, I'm calling back in so I can hear Chris. So I need y'all to pick up the Skype, but I actually lost it, his signal. There we go. All right, I got you back, Chris.
Yes, sir.
I can now hear you.
This is how good you are. You're Skyping
But you still got to give me one name. You got to give me a name. There's somebody who you now follow, who you didn't follow before, who now is like, yo, that person's dope.
Roland, there's an echo that's going like 5 times every time you talk. It's like, yo, that person's dope. That person's dope. That person's dope. That person's dope. So you need to fix your ATM switch. Can you hear me? Yoo-hoo, Roland.
All right. Chris Spencer, I know you don't need the money. What's your cash app?
Money sign out too much production.
Money sign out too much production.
What?
Yes, it was my cash app.
Yes, it was my cash app.
What is it again? That's long as hell.
Oh, no, I was just making a fake one up.
Somebody accidentally sent me some money.
Well, give out the Buddy Lewis cash app because we know his broke ass need it.
Yeah. Purple and gold got a bogey.
Purple and gold got a bogey.com, something like that.
Do you question why you still friends with Buddy Lewis? I do.
That's my boy.
That's my boy.
30 plus 30 years.
30-some years. But I love when y'all get together. Please. If you can, with your little ATM switch.
Show you and him stepping.
Show you and him stepping to close this show up.
Oh, no. He was on last week, and then he tried to lie, Chris. He tried to lie. He tried to tell my audience that I did not outstep him, that the video I played was the second round, but while he was lying, he didn't realize I had it queued up. It didn't end well for him, Chris. Chris, it didn't end well for him.
Did you hear what I said? You had it queued up.
Did you hear what I said? You had it queued up. No pun intended.
Yeah, he was. He got off the show cussing. He got off cussing, but it's all good.
That's good.
It's all good. Chris Spencer, always good talking with you, man. I look forward to doing the date night with you and your wife.
6 p.m. PST.
And hold up, I do have to say this, y'all. Let me apologize. So Chris and I play golf, and y'all, Chris is in LA. So there's a certain type of song, a musical genre. Me growing up in Houston, that is the Gulf Coast, that the sound don't get to LA. I was playing some music for Chris, y'all, and Chris just stopped even playing golf, and he was shazamming.
From the first time it happened, we were at Anthony Anderson's celebrity golf tournament.
And I said, let's
balance the music. He's like, Chris,
you don't want to do that.
You don't want to do that. Go on over there, friends. I said, what about this? I said, what about this?
And he went, what about this?
And he went, what about this? I told my whole, I wrapped all my stuff up. I was like, we know what? We lost. Go listen to Roland stuff.
And part of the problem, Chris had a little speaker. I had a bigger speaker.
Oh. Yeah, you won. The music was better.
Yeah, you won. The music was better. It sounded better. You were in
7G.
You were in 7G. It was unfair.
Well, y'all, we were on a golf course, and I played that song by Big Pokey, Side Piece. Chris lost it. Chris is like, I ain't never heard of this music. But you went home and you played it. It didn't end well for you, did it?
I didn't even know we were up.
No, I slept on the couch that night.
I slept on the couch that night.
She appreciated it later when I told her it was just a joke.
Good. All right, well, look, we appreciate all good music. Y'all, we always have a good time. Yes. We get together, play golf. It's always last. And Chris, I'm so mad because I cannot remember the comeback. Y'all, Chris cracked on me at the ABFF honors with my African attire. With my African attire.
So
I said Boris Kojo, Anthony Anderson, Aegis Elba, Roland Martin, all went on this pilgrimage to Ghana. And as you can see by the way he's dressed, no one enjoyed it more than Roland Martin.
He said he bought everything.
I said,
and I was like,
usually people get mad when they lose their luggage. Not Roland.
And I text Chris, I'm calling Trump to put you on the do not fly list.
That was funny. I wish I would have saw it while
I was on stage.
Yeah, because Chris was like, I need to go get me some stuff. Where Roland got hit, I'm like, nah, you gonna be on do not fly list. Your ass can't go. It ain't gonna work. It's always fun, man. Tell the wife what's up. We'll get together soon.
Love you, boy.
Absolutely. Date night.
Absolutely. Date night with Vanessa and Vanessa.
All right, we'll be checking it out. All right, y'all. Date night tonight. Instagram Live with Chris Spencer, his wife Vanessa, Holly Robinson Pete, as well as her husband, Rodney Pete, 9 p.m. Eastern, 6 p.m. Pacific. All right, y'all, we got to go real quick. Here are the people who've given $50 in the last 24 hours for our Bring the Funk fan club. Aquana McAllister, Brian, Elmer Foster, Gregory Horsley, Isaac Surgic, Jacqueline Williams, Joyce, Kenneth Blair, Michelle Egerton, Nichelle Peck Glaspie, Otis Ingram, Rashida Chandler, Ricky Blaylock, Tony Strother, Wavon Lloyd. I want to thank all of y'all who joined our Bring the Funk fan club. Our goal is very simple, to get 20,000 people donating by the end of the year. $50 or more. That will completely fund us. This is about us being able to have a platform to do what we do, to be able to have the Chris Spencers, the Teddy Rileys, and so many others who are on every single day. Y'all know what we do. It's about speaking to our issues that matter to us. And so please go to our Cash App. Pull it up right now, folks. Cash App, $RM Unfiltered. PayPal, paypal.me/R Martin Unfiltered. And, of course, Venmo at RM Unfiltered as well. And so you got all the information there. And so we certainly appreciate it again, folks. And again, so thank you so very much. I shall see you guys tomorrow. Roland Martin Unfiltered. Look forward to a great time. Okay? I'll see you.